Hi all, welcome. We're gonna just be letting everyone come in, filter in the next 5 minutes or so. Until then, if you could drop a check-in in the chat with your name, pronouns, affiliation, your location, and everything that's up on the prompt there, that would be great. We just like to know who's with us. All right, I see more folks entering. If you just want to check in the chat. With what is on the board, that'd be great so we can know who's here. And I think we'll probably go ahead and just get started. So I just want to welcome everyone back to our third part of the series of creating organizational change with Dr. Jaboa Lake and Race Forward. We're so happy to have you all back today. A few quick reminders. Again, checking in the chat. Feel free to write questions, comments. We really love seeing what people have to say and kind of compile that into our toolkit afterwards so we can see what people's reflections are. Same with coming off mute during discussions. We love to hear from you. I'm going to drop the Padlet in the chat as well so everyone can see the slide deck. So you'll just be able to open it from the link and there'll be some resources in there. And I'll go ahead and pass it on to Dr. Lake.
Hello, everyone. Good morning, good afternoon, depending on where you're coming in from. It's good to be with this group again for a third week in a row. Appreciate you all. There's a lot going on right now, and I want to acknowledge that spending our time in the spaces that we do shows where we place our energy and our values. So appreciate you all spending your time here and seeing this as part of the important parts of your work too. As was mentioned, we did create a Padlet for you all. There's a couple of things I did want to share about the Padlet that are going to be resources for you all going forward. So you can still see my screen, right? Okay, cool. So in the Padlet, we have a section for the session slides and materials. So it has all of the slides from the slide decks that are here available for you all. I'm also going to add any other materials that are related to the sessions. And then we also created a spreadsheet from group responses to the prompts from the last couple of weeks. And these are from the mentees and from the chat. So when you open it up, it'll look like this. And it's all just anonymized responses to some of the prompts. So the first week we asked around some narratives, some things around values and frameworks. Last week we had some questions around power. And then this week we'll be asking some questions for you all around challenges and barriers and tools and tactics that you use in your work. And we'll be adding those responses as we go. So this way you can go back to the collective knowledge, the collective strategies, the collective skills of this group and explore some of the responses that other folks were putting into the chats and the mentees along the way. So hopefully this will be a continued resource for you all. And as I mentioned, we'll add more after this session. So definitely encourage folks to contribute to the mentee in the chat along the way so that that knowledge can be compiled here for everyone. And then we also have a tab for resources and tools where I started adding a couple of the tools that were introduced last week. And then one thing that I was thinking about for this particular group is around how many great trainings there are out there and additional kind of materials around workshopping and training. So there are a couple of trainings that I'll add some links to under additional trainings and workshops. If you all have resources and trainings and things like that, continue to very much encourage you all to put them in the chat because we'll be compiling those and adding those to this collective set of knowledge in the Padlet also. So thank you all for what you've added so far and the contributions, because again, this is creating this shared body of knowledge for us to refer back to in our work. Okay, so for that, week 3, so the week 3's subject areas around create. So again, this is the third session out of 3. And in the first session, the part 1, we really focused on learning. In part 2, we focused on discussing. And then part 3, which is today, we're going to be focusing on creating together. And I'll give a quick overview of the first 2 weeks again, similar to what we did last week, just to catch folks up and for folks that might have had to miss one or both sessions previously. So Session 1 from week 1, we were really thinking about learning. So we talked about the traditional harms of research and alternatives to harmful practices. And we also talked about integrating data and narrative strategies in our works, especially when they contribute to things like programmatic building out, decision making. Some of the key highlights from that session were around thinking about traditional research that impacts decisions to harm communities. We also did an overview of new approaches, such as decolonizing approaches, liberatory approaches, critical systems analyses. And we also reflected on how we've shifted practices in our own work. And you all gave a lot of great reflections there. And on the screen, you can see some of those reflections that you shared from some of the prompts that we had. And again, now in that Padlet, you can see all of the responses that you all gave during that first session. And then in week 2, last week, that was around discussing. So we had goals around identifying guiding values and narratives, and then talking about choice points and shifting practices. And some of the highlights from that session were around discussing power and positionality. We also talked about the racial equity impact assessment tools and how we can think about the tools that we use to make decisions in our work. And we also introduced a framework and a toolkit around values-driven research and decision-making. And on the screen at the top there, you can see those 4 arenas of power that we discussed around decision-making power, narrative and cultural power, resource and structural power, and relational imaginative power. And then you can also see at the bottom the values, principles, praxis framework. And we're talking about practice and praxis again today, where we talked about what values we hold in our work, how those translate to principles, and how that helps guide our practice as within our work. Thanks. I'm actually going to pause for a second because I want to read some of the intros in the chat. Welcome, everybody. It looks like I have a lot of neighbors. I live in DC, so I definitely see some DC folks here and some Maryland folks here. Welcome, everybody. Thanks for letting me be nosy for a second. So just jumping into today's session, again, we're going to be during this week, we're going to be talking about create. So we're going to be talking about emergent and shared strategies, and we're also going to be talking about practices for change. So really getting into like those practical lessons, those practical pieces that are going to help us actually transform our work. So this may look familiar to a lot of people here, but one thing that we wanted to talk about is really getting at the roots to inform change and thinking about things like root cause analyses. And root cause analyses are things that we often do in our work as practitioners. It's very much an organizing tool. And what it does is it helps us identify the causes to intervene and build rather than treat symptoms. And by intervening and building, then we can create more transformative and long-term changes that are helpful for communities rather than upholding harmful systems or only doing temporary changes that are going to fix things. So as we all know, sometimes we see a problem and the first response to it is to just kind of do the quickest thing that's going to appear to fix it or appear to alleviate that issue. But oftentimes that doesn't mean that the actual cause of that issue is being addressed. By engaging in root cause analysis, it helps us better identify points of intervention. So when we think about root cause analysis, there are different points that we can actually intervene. And when we're thinking about programs, when we're thinking about decisions we make, when we think about even advocacy, and understanding the points of intervention, and then alongside that, understanding where we hold power and where we hold resources can help us be more realistic about the type of change that we can actually accomplish, especially in different environments that are rapidly changing around what we have access to or where our power lies. And there's a couple of these root cause analysis activities that you all may be familiar with, but I wanted to introduce just in case. And they all have different purposes and different structures, and they can fit different settings. So one root cause analysis that's often engaged in is what we call the 5 whys, though it's really kind of infinite whys. And this is the activity where, a problem is identified, and that problem could be anything from disparities in this health outcome in the community, or it could be a problem where it's we don't have enough labor and resources to enact this particular program. Whatever the problem is, start by asking why, and then keep asking why until you get to what is called the root cause. So for example, if we're thinking about there is a public health crisis because of it could be anything. There's a public health crisis because of X condition that is happening to X community. And we can then ask why. And by asking why, we could say, well, then this happened because this happened. And then we ask why again, and we could say this happened because that happened. And when we keep asking why, it helps us actually get to the root cause of the issue rather than just being stuck at that at the issue level. And I'm going to talk a little bit more about individualizing problems and narratives in a little bit and why this is something that's really helpful to do. One thing about the 5 whys too is that it can help us attune to where our biases lie or where we might be misleading the actual root causes. So for example, we may have programs or policies that are really addressing one thing, but if we were to do a root cause analysis by asking those 5 whys, we may actually identify a different root cause that helps us identify that the work that we're doing or the program that we're implementing or even the research we're engaging is not actually enacting or engaging with the right type of root cause to actually impact that problem, and we may be off. So it can be a good way to help us shift our work too by identifying where we're actually having engagements and where the actual root causes are happening. Another root cause analysis that is pretty common is around what we call the fishbone diagram, and that's the one that you can see at the top right of the screen. And the fishbone diagram is more about looking at the different components that contribute to problems. So in this one, you can see that it's looking at a problem, but it's identifying like, what are the people, what are the materials, what are the measurements, what's the environment, what are the machines, what are the processes. So these are for folks who really want to get pretty technical and be like, okay, we have this problem, but let's really identify the components that contribute to this problem. So instead of the 5 whys where you're kind of backtracking to look at the root causes that way, you're actually looking at the different components. And in this way, you're differently able to identify a point of intervention where instead of a point of intervention being at the systems level, it can be about the components level. So our problem, we might see that it's really a materials problem, or it's really a processes problem, or it is a systems or environment problem. And that can help us identify, again, where we want to have that point of intervention or where we need to make some change happening. And then the last one I'll introduce is the tree diagram. And this one's pretty common too, where it's about identifying, the trunk of the tree, which is the problem, and then identifying not just the causes of that, which may be many that branch off in many different areas, but also the symptoms of the problems. And those are the kind of leaves. So what is the problem actually bring symptoms out of? And then there are 2 components here that I actually added because this is the way that we tend to talk about it. We also talk about impacts and we talk about repetition. So in blue, you can see those 2 words, impacts and repetition, where symptoms then contribute to the actual impacts that are being had on the larger environment. So the air around the systems or the air around the tree. And that's something that's important to identify too, because if we only think about the symptoms and not the impact, then we're actually missing the breadth of the ways that different problems are actually having impacts on communities. And then the acorn, which falls from the tree, is where we call repetition. So when we don't actually address the root causes or the problem, then we are at risk of repeating these problems or repeating actions that then grow upon each other. And, I love forest, but, it could be a forest of problems in this particular metaphor. And then we can also realistically think about there are still barriers, there are still roadblocks, and we can identify root causes all day long. We can identify components all day long. But if there are realistic barriers or roadblocks that are happening, that can stop our work point blank. So at the same time, we really want to be able to attend to what the barriers are to our work right now. And there's this systems analysis that we developed from working with a lot of mostly grassroots organizing groups, where they did a project where we asked different organizers and activists who were working on transformative change, specifically within different justice intersections, where the barriers to engaging with their work were. And we asked a couple of questions. We asked them the barrier for them individually engaging in social justice work. And we also asked barriers to building partnerships and coalitions. And from those barriers, we identified this systems analysis of 6 where barriers tended to lie. And barriers were identified as intrapersonal. So these are the barriers that were more personal to individual people. So people identified things like internalized white supremacy as a barrier to engaging in change work. They named things like fear, like I'm afraid to, it's just something that I'm not quite brave enough to engage in yet. And those are really raw and honest reflections that folks had. Folks also identified interpersonal barriers and roadblocks. And these were a lot of things around, honestly, like there's bad blood between me and this person, and it's stopping us from actually engaging in our work. But that was identified, and that does bring some of the humanity into the type of change work that we want to do. It reminds us that, there are systemic and kind of structural barriers, but sometimes there are relational barriers too. But people also identified barriers that we'd categorize around intra-group. So this is around conflicts within a group. So our group maybe doesn't have a shared North Star, or our group doesn't, have the same goal for the type of work that we want to do, or there's something within our group that is, under-resourced, so we're not able to actually engage in the work. So these were intra-group barriers. We also heard intergroup barriers, and these were things around groups, conflicts between groups. So we're not in relationship with other groups. Our work is being siloed, or, we've had a bad relationship with this group in the past, where it stops that relationship building or coalition building to actually hone in our collective power. And then within all of this, we also identified two ones that kind of overarch all of those barriers, one called structural resource and one called systemic. In structural resource, we're really about, we don't have a place to gather, we don't have enough funds, we don't have the support for this thing, these really structural resource related barriers. And then there were also systemic barriers that were named, and these are the larger ones, like, racial capitalism, imperialism, these really big pieces that when we do root cause analysis, we often land on the root causes of these systemic causes. So this is a particular model that is helpful, especially when we're thinking about organizational change. Again, as we identify where we want to have impacts and where we can have interventions, also identifying where our barriers are so we can work on alleviating those barriers along the way. So if we want to have the impact that we want to have within our research, within our organizations, within our programs, within our policies, identifying instead of ignoring barriers and roadblocks helps us to break those down so we can actually have the impact that we want to have. So with that, I want to hear from you all about these, because I know that we're in a time where there are additional barriers. There's a lot going on. There is stripping of funding, stripping of resources. There are, not to bring the mood down, but like a lot of barriers and challenges that are going on right now. But by sharing these barriers and challenges, we can also share with each other what we're dealing with and make each other realize that this is actually a systemic thing that we're all dealing with. It's not just me, or not just my organization, or not just my institution. So I dropped a Menti in the chat, and I'll invite you all to think for a minute and respond to the prompt around barriers and challenges. So what challenges or barriers have you encountered when translating your values into practice, as we talked about in past weeks, to address root causes? TRDL, the big question is, what barriers are you coming up in your work? These could be barriers at any of those levels, again, those intrapersonal levels, the systemic levels. So I'm going to pause for about a minute and let you all sit with that and start responding to that Menti so that we can start sharing with each other what barriers we're coming across. As you all continue to reflect, I put the Menti up on the board for folks to see some of the responses. I'm seeing things: funding, that's a big one; individualism, being silenced, ignored, or gaslit by my supervisors. That's really rough. That's a rough one. Lack of training, partners or allies rolling back their equity agendas. Addressing root causes takes time and resources, definitely. The challenges is that funders and partners want or need to see results quickly. Another one, the low-hanging fruit or the quick win derails our work. This is a big challenge, I'm sure you all know, when it comes to thinking about impact too, especially when our work has long-term impacts. The need for an immediate kind of celebration of something rather than understanding that things take time is definitely a challenge. The habit and practice of treating symptoms for so long, and the unwillingness to truly shift resources to root causes. That's another large one too. And we can even think about like the sunk cost fallacy with that one, around if we're putting all of our effort into these things that kind of help things for a little bit, it can be hard to shift to something that seems bigger to address those root causes. Not enough backing from senior leadership or higher ups, funding, org support, equity rollbacks. I'm interested to hear from some people. Is anyone willing to come off mic and either share what they added here or reflections on what they're seeing from others around barriers and challenges? Kara, I don't know if you were raising your hand or if you'd like to come off mic. You're welcome to say something.
Both. Yes. One of the things that I've encountered and realized is a bigger problem would involve people with disabilities that also have chronic illnesses, how that's been a value of trying to have people understand that that needs to be questioned with every point of entry for medical care and consistently, and that is not valued by a lot of providers and their staff. And I think that's because of lack of training, but that's definitely been an issue that I've noticed. Thank you.
Yeah, thank you for sharing that. I think I saw lack of training as one of the pieces up there too. But thank you for naming that. Seeing a few other things, addressing root causes reveals hard truths for people in power, our board of health and elected official barriers to addressing the root causes of equity work. Is there another person that would like to come off mute and share their reflections or what they added? I'm seeing someone say the low-hanging fruit one, thumbs up, thinking that I think that means that resonates with you on that one. Kelly, I think I saw you come off mute.
No, I just turned my camera on. Sorry. Thanks.
No, you don't have to talk if you don't want to.
I mean, I can, but I can always talk, but I talk a lot. So I want to make sure others have a chance.
Kelly, I welcome you to share since others are, I think, still sitting with what they're reading.
Okay. Yeah, I mean, I think realizing how kind of universal some of these are, and I mean, yes, they're all interconnected to the nature of the problem. It's both like challenging the status quo and what are some of the cultural norms that lead us to having the status quo that we have and how we challenge those in the spaces is sort of what I'm seeing here. Personally, I'm newly sitting with this question of how do we keep doing the work while talking about it differently, and that balance between risk and impact in the current environment is sort of a question. But I think it's great to have spaces like this where we can share ideas because it sounds like there are a lot of common challenges here.
Thank you for naming that. And one thing that I'll name is that in a lot of org spaces where we're trying to build relationships across organizations and institutions, one thing that we've been enacting a lot of is doing risk assessments. So as a ecosystem, as a field, who is more risk averse because of whatever reason? Who is open to accepting risk publicly? Where do people lie? Where do organizations lie along that? And that helps us identify who can be most bold and use that voice, who potentially needs to be protected in these times, but also who could use their voice a little bit more, but have some hesitancies. What are those hesitancies too? So having those kinds of risk assessments at an ecosystem level are really helpful in identifying how we can continue to work and support each other, especially when there are these challenges and barriers. And again, these challenges could be legal challenges. They could be resource challenges. They could be narrative challenges. It could be so many different things, but we don't know that until we start talking to each other. We also wanted to talk a little bit about what we talked about last week around critical reflections and praxis questions. And this is another tool where we can really think about, we are all very critical people in our work, and we're constantly having these critical reflections. But what does that mean for actually translating those reflections into actionable items? And this is where that praxis piece comes in. So as we talked about before, praxis is really around the practice being informed by values and theory for action. So how do we use our values? How do we use the principles that we identify to actually create action and in a principled way within our work? And this is a way to help identify, if I need to shift this work somehow, how do I start, where do I start thinking about how I shift my work? And it's by recognizing that we have critical reflections about our work all of the time. Every day that we're doing the work, we have, either this, kind of this gripe or this groan, or this critique or this question, or whatever it is that is a critical reflection at the end of the day. But instead of having it just stop there, by collecting those critical reflections and thinking about what are the praxis questions that can be invited from those reflections that can help us shift our work and the change in our work. And I'll give a couple of examples of how to use this kind of process of identifying your critical reflections and then identifying praxis questions for change from there. But I did want to do a quick call back to this example that we gave during week 1. So during week 1, when we were talking about alternative forms of doing research and decision making making that combat harm. And this example was given around how we choose data analytic strategies for decision making that impact communities. And within this one, if you see the mediation model at the bottom left of the screen, you can see that this particular model is measuring what they call total vaccine hesitancy. And they look at two predictors. They look at distrust and mistrust. And this is self-reported scales. But one of the criticisms from this kind of way of looking at a problem is that they're looking at vaccine hesitancy and only measuring it with the predictors at that individual level. So when that comes to thinking about things like interventions or programs or even policies and resource distribution, it's going to be stuck at that individual level. So we need to fix distrust and we need to fix mistrust, and that's going to solve vaccine hesitancy. But we know that vaccine hesitancy is a lot more than that. There are historical implications. There are a lot of communities that have been harmed by medical systems. There are a lot of communities who have had real impacts from things that they've engaged in. So we know that it's not just about mistrust and distrust. And it also brings into the question about if systems are being distrusted, are they trustful systems at all? Or, so is the issue that we need to shift mistrust and distrust, or do we need to have more trust systems that can earn our trust? So this is the example. Sorry, I had my screen paused, but this is example from last time, and this is the mediation model that I'd named. So you can see the total vaccine hesitancy and then mistrust and distrust. So the critical reflection from this kind of data analytic strategy that informs decision making is around how do decisions about what data to analyze impacts what's known? How do these shape policies and programs and impacts on community? And then when we think about praxis, we can think about things like the ecological model. So if we really think about like getting at the root causes, then we don't just stop at this individual level of thinking a problem. We also want to think about the relational levels, the community levels, the societal levels, the intergroups, the interpersonal, all of these different levels, which actually help build out a bigger picture of what contributes to that issue. So something like vaccine hesitancy. And in that work, we can think about a couple of questions, such as what is included or excluded, who makes analytic decisions, why are those decisions made? And we can think of these types of questions as those praxis questions, because asking each of these questions can lead us to actually making different changes or actions in our work. So in a project like this, if we asked about what is included or excluded, then we would see, well, everything outside of the individual level is excluded here. So what does that mean for what we actually know? What does that mean for how we make decisions based on this data? If we think about who makes the analytical decisions, we can say who even chose to do a mediation model, who chose to measure this, who chose to make this scale, and that can help reveal some of the gaps in our knowledge in these areas too. So this is an example of where you may be engaging in your work where you're like, let me look at this study and help it inform the program that we need to implement, this policy we need to push for. But my critical reflection might be like, why is this all at the individual level? And I might be having those kind of praxis questions coming up that can shift and lead my work differently. So a couple of other kind of critical reflections to praxis questions that we could offer here from past discussions in the last 2 weeks. We had folks that were critically reflecting on things around narrative and cultural power. So one critical reflection might be something around like, narrative and cultural power impacts organizational processes that impact community programs and policies. That's pretty wordy. But our praxis questions from there could be something like, who gets to shape meaning, define norms, decide what's legitimate or desirable? And when we ask those questions and help identify them, well, then we could say, well, like, okay, it seems like the people that shape meaning for our community are people from the top. How do we actually shift this so we get folks at the grassroots or folks from community actually shaping meaning? So by, again, identifying these praxis questions from that critical reflection, we can actually move towards action. Another one from the bottom there, and this is a reflection that we heard from you all in past, was around our work feels siloed and is being gutted. This is kind of a resource question. It's a relational critical reflection, but we could ask this praxis question around where can we strengthen relationships to resource share instead? And that can lead us to some action around, well, that means we need to strengthen some relationships. So maybe we need to reach out to this group. Maybe we need to resource share over here. Maybe we need to just know what resources are even out there that we can lean on. So again, this is a way to reflect on, like, if I'm feeling stuck in my work where I know something needs to change, I know different decisions need to be made, I know we need to kind of critically shift our practices, using all of those critical reflections that we have every day and then changing those reflections into things that we can ask ourselves that then lead to action. So it's just an offering here around, we won't engage with this question as a group, but what are some of the key critical reflections and praxis questions in your work? And I'm sure you all could go back and like identify a bunch of these because we all have a lot of critical reflections every day about our work. And another framework that has been helpful for a lot is around just really being specific about identifying our tools and exercising our power for change. So it can be a lot to be like, we think we have this power, we think we have these resources, but when we think about, kind of leaning into movement theories and movement strategies, a lot of campaign theory, a lot of social movement theory, a lot of grassroots theory is really targeted around a goal or a policy win of some kind. And to get there, we need a larger strategy. And within a strategy, there's a lot of little tactics that make up those components. And part of this is an affirmation that we need to do a lot of things to get towards that goal, or we need to do a lot of things to get towards that win. There's no kind of silver bullet. There's no one key method. So how do we build out a really good strategy then if we want to actually have change in our work? If we think about kind of just tradition or status quo, tools are often used to uphold oppressive systems and beliefs and create things like harms and mistrust. So, for example, a tool could be legal strategies, and we know that legal strategies have traditionally been used to uphold oppressive systems. But if we think about action and liberatory methods and practices similar to what we talked about earlier, then we can think about tools that are being used to interrupt harm, to engage in repair, and to build solutions that work for all of us. So thinking about the tools and tactics that we engage in is both about identifying like what has been worked against us and then what we can actually use to build towards what we need to build towards. So using this type of framework around movement theory and strategy can help us identify within our institutions and within our organizations where we want to move. And then just an offering of like some of the tactics that many organizations or institutions engage in are like, research is a tactic in itself. So by engaging in critical reflective research, resources are things that can inform the tactics that we engage in. Different skills that we have in-house or within our networks can be different tactics. Our relationships are some of the tools that we need for our strategies. And there can also be programmatic things that are really helpful in getting us towards that goal or that win. So thinking about that, you all have identified your roles in past sessions before. Some of you have said you're researchers. I think I've seen some publishers, some funders here. So if you go to the Menti, there's a button at the bottom that should say next question. So I'll ask you all to engage in this next question and this next reflection. I'll give a minute or two for you all to reflect and then start putting into the Menti, but inviting you all to think about that. So what tools or tactics can you use to shift power and create change within your work? So what are the things that you have on hand? What are the things that you have access to? What are the skills that you have that you can actually think about as part of a larger strategy? I'll give a couple minutes for you all to reflect and start responding to that Menti. Seeing a couple reflections coming through. Folks are talking about relationships, audacity and courage. It is definitely a tool. And it's something that needs to sometimes be trained and exercised too. And we can name some of those pieces that we need training and exercising around. The ability to convene and be thought partners, regrouping with early core base to re-engage smaller subset of members for meaningful action during challenging times. Leaning on community voices to raise concerns, questions, and challenge leadership. Organize the ones with expertise but no power against those with power but no expertise. That's a strong one too. Mm-hmm. Respectfully, strategically question power structures, organize with like-minded folks. Using data to make a case for change, requesting resources. Is there anyone that feels called to share or reflect on what they're seeing so far? I'm also curious about, as you all reflect on the tools at hand, what are some of the tools that you need, but you haven't been able to access yet? I'm seeing in the chat, audacity and courage, tools I haven't been able to access, to be honest. Is this something that you're willing to come off mic and chat a little bit about what you might need to access those tools?
Yeah, sure. Can you hear me? Okay. I think, given the time we're living in, and when we think about equity, there are terminologies that are getting banned these days from our epistemology. And like in that space, speaking up against people in power even within the realms of organization, can be very scary. Like, what would be the repercussions of it? So I think that that's the reason, like, thinking about the consequences of my action, even if my intentions are for, health equity, equitable access, and whatever, if I stand out alone, if I stand up alone, I will be punished alone. But that's why I also think, like, if we do it in an organized way, that might be great. But when you think about organizing, you need to talk to other people. But who do you trust? Because institutionally, under capitalism, all the organizations are kind of structured in a way so that there is no class solidarity. So I kind of, like, sometimes think about that. I work in a private institution. We don't have unions. So there is no space where I can, like, find like-minded people where I can speak up the things I think are necessary to do. Frankly, that's what I was thinking about.
Yeah, I appreciate those reflections, and those are real and raw, and often we don't get to talk about those. So I appreciate you bringing that up, especially around what does it look like when we need to support people who are being punished for being bold, for being raw? What does it mean to build a system that actually supports each other in being able to be bold? And, some of those strategies have come out around, we need to have a collective letter. They can't come after us all. So this is another organizing strategy where if you have enough people, there's this, idea. It's like they can't come after all of us. So the more people you have, the stronger you are together by overwhelming their punishment systems in those ways too. It also shows a united front that this isn't something that is just an individual person who is speaking out against, but this is something that many people are that. But it's, again, getting folks to that critical mass that can be really challenging. So being the first in that critical mass, showing folks that you're willing to take the risk. And sometimes seeing that somebody is being supported in taking those risks can be it. But that does take some of those more bold. I think it was Adela in the chat asking about risk assessment tools, and I can add some to the Padlet too. But that's also something. So even like in a union structure, if you have a union and there are some folks who are like, we need to be bold as individuals, who in this union's ready to go, ready to be, take that risk, and who maybe needs some more support, so we can actually strategize how we roll out people's voices, so that can be a tactic in itself. I'm also seeing in the chat, allyship between minority groups is really compelling. And that's a huge piece too. Not just allyship, but also solidarity. Supporting allyship is a lot about how we support each other through our voices and through these pieces. But solidarity is often about how do we actually show our positions and struggles as interconnected, so that what happens to you happens to me too, so that we have this kind of shared struggle in mind too. And I also saw, Michael, you wrote in the chat, as happens often, reliable and partial data has been an ongoing issue. Is this something you're comfortable coming off mute and sharing a little bit more about? I'm curious about your thoughts on that one.
Yeah, sure. In looking at data around claims, insurance claims for children living with disabilities, and the, I guess you could say, wrongful and kind of bad faith denials that, are seen by others, but especially, with, this subset population of children living with disabilities, it's been really hard to get consistent data, whether it be at the state or federal level, just because of how disjointed the claims systems have been, and the lack of transparency.
Yeah, based on what you reflected on, are there certain things that you feel like you could identify as like, this is actually a really great point of intervention to help alleviate that issue?
But there are, but it does require a level of cooperation by, insurers that, right now seems like, that would be a wish list item, just because there is no incentive for insurers to be part of that conversation, at least for now. So, there is data available at the local and institute or organizational levels for folks who are interested in this issue. But, that's very fragmented, and, creating, creating a picture that is representative of what's happening around the state, so that lawmakers can make a case for what needs to be done. Like, that's still, pretty far away.
I appreciate you sharing that piece, especially around the cooperation piece. A lot of what we're talking about here is, I think, with the recognition that most folks here are here because they're interested in change, they're interested in justice. But sometimes we need to work with folks that do not have the same value set with us. So what does it mean and what does it look like to really hone in on our values and hone in on our praxis when others aren't doing the same, and yet we need them to change? So how do we shift other ecosystems? And that piece around cooperation that you shared was really, I think, compelling about another strategy that we need to attune to. It's like, how do we work around things sometimes? How do we work with things to pressure them to change? How do we sometimes reject things that we can reject? Not in this case, but there's sometimes we can just fully reject and be like, if you're not going to come along in this way, or if you're going to contribute to harm in this way, maybe we don't need to cooperate that much with this particular entity or group until they come along with our value set. I'm also seeing a few other things that have been added. Following grassroots org leadership, if I can't lead the work at my institution. Share stories of success doing things another way. That's a big one too, and gets asked about a lot. It's like, how do people actually, get to the win? Convening space for strategy building, finding safe avenues that concede, challenge in small ways, and still help challenge the status quo. Storytelling and community listening. Are there other things that are calling out to folks? I see, Anna, you also put another note in the chat. Is that something you'd like to say out loud?
Sure. Thanks for giving me the opportunity. I'm just going from clinic within clinic, so I'm not able to turn my video on right now. But I just wanted to explain this further. I think it's a topic that is, whether it's beloved or not, I think it's been ignored quite a bit, just because it really puts a lot of equity deserving groups who are in this work in a tough spot where they might be, have to reflect on their own biases. I've seen this quite often in my workspace anyways, there's a lot of women, actually racialized women, who are in powers of leadership. And, when it comes to concerns from other equity deserving groups, so it could be somebody from the transgender community, they will not even include a lens for decision making, but they will focus on perhaps the white individual in the C-suite that they're working closely with. It's also the case when it comes to faith, very sensitive topics, right? Where we maybe we look very similar in terms of the race or skin color, but maybe we have different creeds. And so that tension is definitely being seen here. I'm in Ontario in my workspace, which is a hospital, unfortunately. And it isn't between dominant groups, it's between groups who are still being colonized, right? And continuously oppressed. And it's very sad. It's very sad because I think we do have power there that we can leverage, as you said, solidarity.
Thanks for naming that too. In the slide before this, we had named like the status quo tools about, using tools to continue to contribute to oppressions. And it sounds like, you're naming those things, like keeping groups in conflict with each other, keeping groups not in solidarity or in allyship with each other is a tool to then keep us, repressed and oppressed. And that then inhibits the actual engaging in things like resource sharing and community building and relationship building that then do lift up all people. I'm also seeing in the chat, engaging with community by convening and intervening them in intergenerational settings is a means to address practical and dispel false information directly and uniformly. Kira, do you have any strategies around engaging community to practice in some of these ways that you feel like you would be helpful to share?
Yes, thank you. So one of the things, I'm sorry, I'm not in a building at the moment. One of the things that some of us have found useful is, I live in the smallest state in the Union. Rhode Island is less than 54 square miles. So looking at data sounds like it should be easy, but it's not. Holding convenings is much easier. And what we've been able to find in doing that is, because the populations are so clear in different places, we have been able to say we recognize that intergenerational living is growing in our state, not just as a means of finances, but as a means of maintaining culture. And the dialogues can be more direct and precise when they're there, because if someone is with other people from the culture or their age group, they're more likely to disclose and share things together. So we've done that by offering food, by saying we're having health reviews, or even doing photo voice projects. Those allow people to say, I had no idea you felt that way. I didn't know this was happening. And there's just a myriad of information that comes out once they get going on what happens there. And what we've done a lot of times is have the youth be the lead on that, because then they realize that they do have agency, and the older generations realize that the children really do want to be involved and have questions. But we recognize that it's also very important for archival information, things that we've seen in textbooks versus what's actually happening, and what was recorded or known by state agencies. So that's very, very important in the means that we've done that. We've also done that. For example, we have an upcoming event. It's canning, and it's learning how to preserve food, because that's agency, it's sustainability. But what we're going to be doing with it is doing it with family members that are reentry program people. So we have them working with their children to do this. And that allows conversation and communication in a means that's not very structured. It's more loose, and we will get real answers and have things that aren't so, well, I thought about this. I did a role playing before I got there to see what's happening. Canning no, it's not online. It's going to be in person. And we will be building a platform off it, because we in Rhode Island, even though it's a small state, we have the highest levels of probation periods in the country. And we're recognizing with at least minimally 10% of the current incarcerated population will be released within the next 15 years. What is that going to look like? So this is something that needs to be addressed and taken account for sooner rather than later. And how does that intersect, as you were speaking about this earlier, with other things, for instance, DCYF, housing, food, and healthcare, especially disability. That's something that has been minimalized about what's happening with people that are incarcerated. That was a long-winded answer, but I hope you got everything out of it.
It was a beautiful answer. You named so many tools, so many tactics, so many strategies, and also just like shifting. I think a lot of what you named is a callback to some of what we discussed in week one around what is the goal of what we're doing altogether? You know, does it need to be data collection in this way? Does it need to be research in this way? Or can we shift it? Can we engage in something that people want to engage in, like photo voice? Can we have a community event that brings people's voices and stories out? You know, a lot of times when we engage in research to inform our programs and policies, it's really extractive. It's like, hey, give me your information, or give us some government data set. Or you can say, we're going to hold this community event where folks are going to want to come. They're going to learn a skill. They're going to get their needs met in some way. And it's going to provide them a space to just talk honestly and frankly and share back with us in a way we would never get. It reminds me of this project that this organization that we work with called Philly Thrive, and it's an environmental justice and housing organization in Philadelphia in predominantly Black neighborhoods. And one of their strategies is they have block parties. So they do a lot of housing justice work. They work on what they call whole home repair bills. They do healing justice work, and they also shut down the largest oil refinery in Philly that was right next to the neighborhood, which is a huge, huge win. Had a lot of health impacts, and they're doing a whole air quality monitoring project that's led by their youth board member in collaboration with a local university. Beautiful work. But one of their tactics is around base building through block parties. So have a block party where there's a DJ and there's food and people can come. And in the middle of that block party, they have a session where they invite everybody inside and have a town hall and a meeting. And that's where they're able to hear the stories that are actually going to make some good decisions about the work that they advocate for in that organization. So I see so many great things from that example. So thank you for sharing that. I know we're almost up at time. So I know that the folks have probably a ton of examples and strategies to share. And again, we'll take these responses from the mentee and from the chat and add them to that spreadsheet that's going to be available to you all on the Padlet. So you can come back to these. And just a reminder that, this is the third of 3 sessions. So thank you all for spending time with this, sharing your stories, sharing your questions, sharing the things that you're sitting with. And then just a reminder that there are a couple of next steps. So we'll be working to add more resources and things to the Padlet. So you have those. The sessions are being recorded, so you should get access to those. And then the sessions and contents and learns will be compiled. I put access. Sorry about that, Rihanna. So it'll be compiled into a briefer report that you all make to send back to folks. And I meant to ask you about how to put language there, but you know what it is. Did you want to talk really quickly about what that offering is after these sessions?
Yeah, so probably in around a month, we will send everything out to everyone that's in attendance, but we'll also keep it on our Partners for Advancing Health Equity library. So you'll be able to find all the YouTube videos, the slides, and then kind of like syntheses for everything, and then the extra materials as well, all in there. And yes, you'll be able to see all the previous presentations as well.
Thank you for that. So a lot of more resources coming your way. And again, this is about creating shared resources, shared stories, shared narratives, shared, thoughts and all of that. So again, you see that spreadsheet that we showed earlier that just has all of your anonymized responses from all the sessions. So hopefully this can continue to be a resource that you can go back to. And with that, I'm going to pass it back to you.
Yeah, and I added the survey in there as well. So it's in the chat, but also you can see it on the screen. Please, if you haven't already for the series, fill out our survey. It helps us kind of look at what we want to review for next year and what is important to our attendees. And I see some questions in here. If there's anything that you all need answered and we don't get to, please feel free to jump on the Partners for Advancing Health Equity website and just email the info and say that, you had a question for the workshop. So if there's anything like that, please go ahead and do that. That's no problem. I'm happy to get back to you. Otherwise, I just really appreciate your attendance. This has been great. Thank you so much, Dr. Lake, for bringing us through such an important topic at this time when I think many people are feeling at need to talk about these things. So thank you.
Thank you all. And I put my email in the chat if anybody wanted to reach out, or if you had additional resources that you think of later on, you're like, oh yeah, let me add that thing. You can email it to me and we can add those to the collective resources too. So thank you all again for your engagement, for your thoughts, for even sitting and being in this space. And hopefully it's of use to you continuously going forward, but use each other as resources, use each other to build your power. And thank you.